Thank you, Drs. Murphy, Fauci, and Walensky. I want to be clear, the President's whole of government vaccination effort is ready to get every American who needs one a booster shot. Pending FDA and ACIP approvals, boosters will be available starting the week of September 20th. The plan is for the rule to be simple. Get your booster shot 8 months after you got your second shot, I apologize. So if you got your second shot on February 1st, you can get a booster starting on October 1st. If you got your second shot on March 12th, you can get your booster starting on November 12th, and so on. Thanks to the aggressive actions we have taken to establish our vaccination program, it will be just as easy and convenient to get a booster shot as it is to get a first shot today. We have enough vaccine supply for every American, and you'll be able to get a booster at roughly 80,000 places across the country, including over 40,000 local pharmacies. In fact, 90% of Americans have a vaccine site within 5 miles of where they live. And importantly, boosters will be free, regardless of immigration or health insurance status. No ID or insurance required. So the bottom line is that we are prepared for boosters, and we will hit the ground running. In the weeks ahead, we'll continue working closely with states, healthcare providers, pharmacies, and national and community-based organizations to ensure Americans know they should get a booster shot 8 months after their second shot. And we will be laser focused on getting boosters to long-term care facilities to make sure residents and staff get their shots and are safe and protected. Importantly, as we continue to vaccinate Americans, we will maintain our focus abroad, as we know this virus knows no borders. We have already shipped more than 115 million vaccine doses to 80 different countries. More vaccine doses donated than all the other countries in the world combined. And just this week, we started shipping the 500 million Pfizer doses that the U.S. pledged to purchase and donate to 100 low and lower middle income countries in need. And in the coming weeks and months, we will do even more to lead the global vaccination efforts, accelerating our work to build vaccine manufacturing and production capacity, both here in the U.S. and in other countries. Our wartime effort will continue doing everything we can to get even more people vaccinated, both here at home and around the world. We can and must do both at the same time, because that's what it's going to take to end this pandemic. And we will not stop until we get the job done. With that, let's open it up for questions.
Thanks, Jeff. And as a reminder, please keep your question to one question. There are many today. First, let's go to Lev Thatcher at Stat News.
Hi, folks. Thanks, as always, for doing the briefing. This is a Mike Ryan quote from a WHO briefing earlier today about booster shots. If we think about this in terms of an analogy, we're planning to hand out extra life jackets to people who already have life jackets. And I'm curious, I know you've emphasized, all of you, that this is a false choice, vaccinating Americans versus vaccinating the rest of the world, but could you explain how there isn't finite vaccine capacity and how booster shots for Americans does not at this moment come at the expense of first vaccine or second vaccine doses for folks elsewhere in the world?
So let me go first, and then Dr. Murthy, if you want to add anything. Look, to end this pandemic, we have to protect the American people, and we have to continue to do more and more to vaccinate the world. Both are critical, and we're already proving that we can protect our own people here at home as we help others. just to give you some data here, in the months of June and July, the U.S. administered 50 million shots here in the United States, and we shipped more than 100 million to other countries. As I said, the 115 million doses that we've already donated is more than all the other countries combined. And during the coming months, when we talk about booster shots, we expect to give about 100 million boosters in the United States. And at the same time, we will be donating more than 200 million, twice that number, additional doses to other countries, on our way to donating more than 600 million vaccines. So we are continuing to serve, as the President has said, as an arsenal for vaccines for the world. And you'll see us do more and more. This builds on our support of the TRIPS waiver, our commitment to COVAX, where we are the largest contributor, the Quad partnership, which we helped to establish, which is on track to produce at least 1 billion doses of COVID vaccine in India for the Asia region by the end of 2022, and our work to support vaccine manufacturing in Africa by providing financing to a South African business to bolster manufacturing capacity to produce more than 500 million doses. And we're just going to keep going and going and going. So this is a situation where we're going to do both. We're going to both protect the American people, and we're going to do more and more to help vaccinate the world. Dr. Murphy?
Well, thanks, Jeff. And Lev, good to hear your question. Appreciate it. Look, I do not accept the idea that we have to choose between America and the world. We clearly see our responsibility to both, and that we've got to do everything we can to protect people here at home while recognizing that tamping down the pandemic across the world and getting people vaccinated is going to be key to preventing the rise of future variants. We know that, we see that clearly, and we believe we have to work on both fronts as we have been. But Lev, when we see data that is giving us essentially indications that protection is starting to diminish in terms of mild, moderate disease, when we recognize that if this trajectory continues, that people who are well protected today may see more vulnerability in the future, we have to act. The science tells us that, our clinical judgment tells us that, and that was a collective decision of the top public health and medical experts in this administration. So again, we will do everything possible to protect people in our country. That's why we're announcing this booster plan. But we will also continue to accelerate our efforts to vaccinate the rest of the world. We take that responsibility very seriously.
Next question, please.
Cheyenne Haslett at ABC News.
Hi, thanks for taking my question. How realistic is that September 20th launch date, given that we haven't seen the official EUA request from Pfizer or Moderna yet?
That is the date that we're working toward, and as we've said, that is obviously pending both the FDA's approval and the ACIP's recommendation. So that is the date that we are prepared for at the beginning of the week of September 20th. Next
Jeremy,
question.
CNN.
Hey there, thanks for taking my question. First of all, why did you guys decide not to limit this to older and more at-risk Americans and simply say that all vaccinated people will need a booster shot after 8 months? And secondly, you say in this statement that the protection against severe disease, hospitalization, and death could diminish. How certain are you about that? And are you saying over time that you do not believe these vaccines will continue to be highly effective at preventing hospitalization and death? Thanks.
Let's start with you, Dr. Murphy.
Well, thanks, Jeremy, for that question. Look, first I would say that when we look at the data, we see a reduction in protection against mild to moderate disease across age groups. And that was an important part of why we made this recommendation for all adults. We want to protect all adults in our country from the worst effects of COVID-19. But our plan does prioritize the most vulnerable. If you look at how we began vaccinating people, Jeremy, over at the beginning of the vaccination effort, we prioritized healthcare workers, long-term care facility residents, and the elderly. And those are exactly the same populations that we will be starting with. So we do prioritize the most vulnerable. We think that's going to be essential, in our goal to ultimately to protect the country and save the most lives.
Next question.
Alice Park at Time.
Yes, just wanted to ask again, Jeff, if you could just provide some more details on the plan for administering the booster shots. You're going to have to reach the same number of people as in the current campaign, and yet many of the federal mass vaccination sites have closed. So does that mean we can expect to see more doses shipped to doctors' offices, pharmacies, smaller clinics, and will states continue to be the intermediary for managing that and distributing that? And secondly, for Dr. Fauci, can you tell us, you focused a lot on the data looking at antibody responses to vaccines. Can you tell us what we've learned about the T-cell response and what role that plays in any decision to recommend boosters or, continue to recommend boosters in the next year or even years to come?
So the first question, there are 80,000 sites across the country. As I mentioned, 90% of Americans live within 5 miles of a site. The booster will be administered at the 8-month mark, beginning at the 8-month mark. We're going to be working very closely, as we have throughout, with the governors and local state officials to make sure that we have the number of places for people to get vaccinated in a convenient way, enough vaccinators in the field. FEMA stands ready to help in any way. As I mentioned, that reimbursement's been extended, 100% reimbursement. So we will make sure that it is convenient and easy for all Americans to get their free vaccine, their booster shot, at or around their 8-month mark. Over to you, Dr. Fauci.
Yeah, thank you for that question, Alice. There, no doubt T cells will play a role, very likely in not preventing initial infection, but in the progression of disease in the situation that T cells usually do in eliminating or blocking against infected cells. The issue is that they are not as easy at all to measure in the standpoint of large volumes of cohorts. And we will continue to study the T cell response, but the important slide that I showed was the correlate of protection slide where you showed there no doubt was an increase in protection of the antibody as you got the titer higher and higher. So based on that, that would be the most easily and actually most common and very likely the most appropriate measurement of a correlate of immunity. And for that reason, that was one of the issues that swayed us towards the relationship between titer of antibody and linking that to the next to last slide, where I showed you could dramatically increase the titer of antibody by a boost that is at the 3rd boost months later. And if you looked at that, the increase was really rather substantial. But again, not to downplay the ultimate potential importance of T cells, but if you look at the relationship between antibody titer and vaccine efficacy, it looks pretty good.
Next question, please.
Ouija at CBS.
Hi, thanks so much for taking my question. If it sounds like effectiveness begins to wane sooner than 8 months, and please correct me if I'm wrong. So if the supply is not an issue, can you walk us through the science of how you landed on 8 months? Please, thanks.
Why don't we start with you, Dr. Murthy, and then Dr. Walensky or Dr. Fauci, if you have anything to add.
Sure. So thank you, Ouija, for that question. So let me talk you through how we were looking at this. We did see that around the 6-month mark in the data, you start to see increases in mild to moderate infection. But we know that the most important purpose of the vaccine is to keep us out of the hospital and to save our life. It's to prevent against hospitalizations and death. And fortunately, we are seeing that still holding at a high level, which is good news. But our anticipation is that if the trajectory that we are seeing continues, that we will likely see in the future a increase in breakthrough hospitalizations and breakthrough deaths. And that's why we used our judgment, Weijia, to see to make a determination of when that point may be. And that's how we came to the 8-month mark. I want to be clear, though, there's nothing magical about this number. Could it have been 1 week earlier, 1 week later? This is where judgment comes in. And it's why we put so much time and thought into this decision, why we pulled the best public health and medical minds from together around the department to look at the data, to discuss it a number of times, and then ultimately to come to that determination. And lastly, let me just say this, Weijia. We have said over the last several months that we are looking at the data closely, and when we see a signal, that we will let the public know and tell them what our plan is. And that's exactly what we're doing today. We put the best minds together in administration. We looked at the best data that we had. We saw a signal, and now we are sharing our assessment with the public with a plan for how to make sure that the protection people still have today from the vaccine will continue in the future.
And maybe if I might, Jeff, just add, another piece of data that we've been looking at is our international colleagues who are ahead of us, both in the Delta surge, as well as have vaccinated a few weeks ahead of us in terms of large portions of their population that have been vaccinated. And data we're seeing from our international colleagues, specifically and especially Israel, have demonstrated a worsening of infections amongst vaccinated people over time. And so we remain concerned about that as we see in the context of Delta variant, some breakthroughs that are occurring and decreased vaccine effectiveness that is occurring in the context of infection. We are watching other countries, the experience of other countries carefully, and concerned that we too will see what Israel is seeing, which is worsening infections over time.
Yeah, and Jeff, one other thing, it has been such a almost reproducible phenomenon with COVID-19. If you wait for something bad to happen before you respond to it, you find yourselves, you're considerably behind your real full capability of being response. So as Vivek said in the introduction, you want to stay ahead of the virus. And if you look at the indications that we've had, including with what Dr. Walensky just mentioned, you don't want to find yourself behind playing catch up. Better stay ahead of it than chasing after it.
Next question, please.
Felicia Schwartz at the Wall Street Journal.
Hi, thanks. What will it mean to be fully vaccinated once people are eligible for boosters? Will it be 3 shots or 2 shots?
Dr. Murphy?
Well, so on that question right now, I think what's very important for people to know is that if you've gotten both shots of your mRNA vaccine, you are fully vaccinated right now. You have a high degree of protection against the worst outcomes of COVID-19. But our recommendation down the line, again, pending the advice and the review of the FDA and ACIP, the Advisory Community Immunization Practices, is that we believe that third dose will ultimately be needed to provide the fullest and continual extent of protection that we think people need from the virus.
Next question.
Josh Wingrove, Bloomberg.
Hi there. Dr. Walensky, you addressed this earlier a little bit, but I'd like you to expand on what has changed. I mean, 5 days ago, with the decision on immunocompromised people, for whom this is a pretty different scenario. Those are people who didn't have great protection in the first place, as opposed to having waning protection. You made a point of saying repeatedly that booster shots weren't needed for the time. And now 5 days later, not only are they being announced, but they're being announced for everyone. Is it the Israeli data in particular that changed your mind? Why the change of position over 5 days? And can you also clarify, Dr. Murphy said this is only adults. Pfizer was EUA'd for 16 plus in December, so we're not that far away from 16 and 17-year-olds being eligible. Should they get a booster when they are at 8 months, or should they not get a booster when they are at 8 months? Thank you.
Thank you, Josh, and thanks for actually noting that clarification. So we made, based on the FDA review and ACIP, and exactly as you said, the note that immunocompromised people actually never got really a good immune protection to begin with. We noted that as of now, we should be offering a third dose of vaccine to our immunocompromised people, anyone immunocompromised who's eligible for vaccination. However, what we've seen over the data that really has been analyzed over the last week or two from data through July, because it was important to really understand the impact of the Delta variant here, we are starting to see waning immunity with regard to symptomatic infection, not severe infection, but symptomatic infection. So we're staying ahead of this virus. And what we are saying is we are planning for a time in, September 20th to say, as we are following symptomatic infection is waning, we have not yet seen that severe disease and hospitalizations is really waning. That's remaining relatively stable, but we're looking at other countries. And as we do so, we're seeing worsening outcomes in other countries. And in the context of all of these studies, different cohorts, different settings across the country and our international colleagues, we've made the decision to plan for these booster doses.
Dr. Murthy, do you want to address the 16, 17-year-olds?
Sure. So it's a good question. And when it comes to 16 and 17-year-olds and minors in general, we are going to let the FDA weigh in on that, obviously do their thorough review. And then based on their recommendations and ACIP's recommendations, we will have guidance to share for those who are under 18. I also just want to underscore one thing to your question about the last 5 days in our message. I want to be very clear that what we have said before, which is still true today, is we do not believe that the general population needs booster shots today. That was true yesterday, it was true 5 days ago, it was true a few weeks ago. We are announcing a plan for the future, and that's extremely important. We want people to understand it. This is a plan for the future, and it's based on an assessment of data, including recent data that we have just come across in over the last few days. We have said from the beginning, when we see a signal, we will tell you, and that is what we are doing.
Next question.
Last question, let's go to Shannon Pettypiece at NBC.
Kevin, we're not hearing a question.
We are not. All right, sorry, Shannon. We'll go to Brenda Goodman at WebMD and circle back.
Oh, hey, can you guys hear me now? Oh, I'm sorry. I found myself in a mute nightmare.
You've got a bit of an echo. Go ahead, please.
Okay. Sorry about that, guys. I just wanted to find out, and I think maybe you answered this a bit, but why are you sort of skipping the typical FDA review process? I know you're saying this is pending FDA review, but why not wait until the FDA's reviewed the safety, the efficacy, and we've gotten that advisory committee recommendation? And are you worried at all about adding to vaccine hesitancy by trying to get ahead of that by making this announcement now?
Dr. Murthy?
Well, I'm glad you asked that question. And I want to be very clear, we are not skipping the very important FDA and ACIP process here. They have an incredibly important role to play in evaluating safety and making recommendations for vaccines. We respect that, we honor that, and that will be a part of this process as well. But the reason that we are not waiting for many more weeks to announce this, it falls into two buckets. One is transparency. We have told the public when we see a signal in the data, we will tell them when we are concerned, when we think boosters may be required down the line. And we are fulfilling that promise today. The second reason is we also want to ensure that people and states and localities and the public more broadly can plan. You can't turn on a booster effort with the flip of a switch. We have to lay the groundwork. We've got to make sure people understand this, that we communicate often about it. So when we were ready to go and start offering boosters, everybody understands what has to be done and who needs to be boosted. And that is why we are announcing this plan in advance today.
So maybe I'll just add that we are very much following what ACIP provided, because they initially advised us on who should be getting vaccinated first, and it is those people who will be the long-term care facilities, healthcare workers, vulnerable populations. It is those people who will be first eligible again.
Okay, so why don't we take the last question, Kevin?
All right, Brenda.
Thanks. I just have a question a little bit to do with the rationale here. So do you have any evidence from the US or from other countries that waning immunity is playing a role in transmission of Delta because it's so highly contagious? Do you anticipate that boosters will help to slow the spread?
Dr. Fauci, you want to go first there?
Yeah, thank you, Jeff, and thank you for that question. Transmissibility is a bit more tricky than looking at a clinical phenomenon such as infection, seriousness of disease, and hospitalization. It is entirely conceivable, and we will be looking at that when you boost and have a high level, and as I showed you on the next to last slide, the increase with a boost is really quite striking, multiple-fold increase, that it is conceivable that that would be important in lowering the level of virus in the nasopharynx, which could have an impact on transmission. I certainly hope that's the case. If it is, then you could really get multiple benefits from doing this. You can get benefits for disease, severity of disease, and then ultimately infection and transmission. But the bottom line, with full transparency, we don't know that right now.
Well, we appreciate all the good questions.